Hey guys, had a client come in the other day, 15-year-old high school freshman that's a runner. 3 weeks ago, he had stepped into a hole while he's doing his 1 mile repeats. And what happens is when you step in a hole, it creates a whole jarring effect up the body. In the sacrum where it meets the ilium, the SI joint, can have what we call upshift, uplift. Right? And it creates dramatic pain in the low back, refers up into the lumbar spine, can even go down into into the glute, into the hamstrings. But it's very similar to where as adults, if we're just walking along blindly and didn't know there was a step or a curb and we just step off, didn't know it was there, our nervous system wasn't ready for it, it can create that too. However, you got to know what's going on, the difference between the left ilium sacrum relationship and the right ilium and SI joint relationship. The two are not the same in the human body. 80% of the population have an anterior hip, posterior hip on the right side. So left side goes front, right side goes back posteriorly. You can also have a flare, which creates a different scenario. So you have to understand that. If you don't understand that, you can't get that person out of their complaint really fast. So what I was able to do, 3 weeks ago he stepped in the hole. A week ago, last Saturday, he could not finish his 5K race. But I saw him on Tuesday, I believe it was. Saturday, today, I just heard that he set a freshman record for his high school, finished the race, and set a record and a PR for himself. So excited to hear